valve is bicuspid, and after that we bring the sheath back just a tad and we rotate. As soon as it passes the aortic valve, you're going to see it turns there. Okay, so we turn and we manage the sheath to put the sheath inside the left ventricle, and by doing that we advance the dilator, and over the dilator we advance again the sheath. So the sheath was in the right spot, and we took the wire out, as you can see there, and now and that's the point we are now. And we had to make some adjustments because we are not planning to do any more angios because of the adverse event that he had in the cath lab. So let's go live to the echo, please, just to show where we are with our sheath. We are in the right ventricular outflow tract, left ventricular outflow tract right now, just below the aortic valve. You can see the sheath crossing the defect beautifully. Let me show that on angio. Angio, please. And there you go. Raul is stepping on fluoroscopy, and we are ready to load the device and go for it. Cesar, everybody knows that you have lots of experience with this procedure. This device, we're planning to use a LifeTech device. You just published a very nice paper in CCI. Would you like to make some comments on how we select the device vis-a-vis the size of defect, please?
I think in this VSD we can choose the type 2, and if it's 4.8 and 5 millimeter, I go ahead with the symmetric device. That is, both discs are the same, and I choose the number 7.
Okay, that's a good point. Let me show what we thought. We discussed here with Raul, and we think we should put the symmetric device, the type 1. And this is an 8 millimeter device. As you can see, the waist in the middle is 8 millimeters. Both discs are the same size on, both sides. They are 4 millimeters larger than the central waist. So that's what we decided to do. This is a floppier device than the old Platzer perimembranous VSD device. So how is
size is that?
The device? Yep.
Which size is 8?
This is an 8. We were discussing between 7 and 8, and based on the 3D pictures, and we decided to go for an 8 because we had like 7 by 5. It was like a buttonhole kind of appearance on 3D TE. That's why we decided to go for an 8. So now it's been screwed, right? We're going to do that underwater, sailing. Can you show here my hand?
Does the windsock influence your choice of devices?
Sorry, when I said here, type 2 is not, it's type 1. The discs are exactly the same. This is the correct device.
So we are on the same page. We agree, right? A little bit difference on the size. Yeah, let me show how we load them. It's going inside the loader. The loader is transparent. Rodrigo is flushing very gently. Yeah, very gently. Again, so as soon as we as we de-air the system here, we're gonna do the transition. See, there was a little bubble over there. You just keep here. Just there.
What was your question, Steve?
Just for this device, is there any influence on the anatomy? So would a large windsock, a large tissue leading from the LV to RV change their selection of devices? I mentioned symmetric, but there are times where an asymmetric device would be a better choice.
The LifeTech device, we have three different types. It's only we have this is the type 1 that the discs are exactly the same, and have the type 2 that we call symmetric, but with the left ventricular disc bigger than the right, and we have the asymmetric one.
Let me
when you do not have
show you
any
that. While I flush, Raul is just transferring, just pushing the loader there. I'm doing gentle flush. Go ahead, Raul. Yeah, so no resistance at all. No resistance, perfect. So it's being loaded, and Raul is gonna advance the system. Let's go, Angel, please. Angel, there you go. Once we are at the tip of the sheath, and you're gonna see that it's coming in a minute, we're gonna shift to the echo pictures, because we're gonna deploy the device on echo, on sole echo guidance, because I don't want to give some more contrast to this boy. So let's make echo bigger and Angel smaller, and Raul wants to mag here. So that's good. It's coming. Can you see, guys? Yeah. So that's good, picture in picture. So Raul is going to open up the left disc in the left ventricular outflow tract. There it is. You can see the disc open. Now very gentle. Are you going to open the waist, Raul? Yeah. We are close there. Yeah. So he's going to bring everything back as a unit until that disc engages inside the VSD. In fact, on the left side of the VSD, it's a very floppy device. You have to be careful not to exert a lot of tension so that you would pull through. I think he's in the right spot right now, and probably he's ready to deploy the right disc. Yeah, he's doing that. Just
that aortic leaflet as well. So.
Yeah,
there you go. Yeah.
Are you guided by echo or by angio, or both?
No, in fact, we are doing fluoroscopy here. You can take some pictures with, your pigtail in the. Let me do that. Just a sec. You can take some pictures with your pigtail catheter, but I don't give any I don't want to give any contrast to this patient. Simone, would you like to go over the position of that device, if it's protruding to the left side, interfering with the aortic valve, or let's take a look on echo. Go ahead.
So here, looking at the long axis, LV. So we see the left disc here. Aortic valve is free, and if you put some color, there is no aortic valve insufficiency, no obstruction, and I can't see any flow, residual flow across it. So I'm moving the projection now. Let me see the right disc better. I have to go down a little bit. Yeah. So it looks very well positioned, but I would like to have a look at the 3D pictures. Just a second. Let's see.
Comment on how you surveil folks for AV block with this device and this particular closure application.
That's a good question. You want to answer, Cesar?
Yes, we performed 56 cases here in Brazil, and we had only one AV block. It's about 1.80%, so it's it was a good result.
This is a very interesting issue, because when we started about 12 years ago placing Emplaster devices, we were very excited, but after around 50 cases, we had some problems. We had a kid that required a pacemaker due to a complete heart block after 3 months, and then we had a sudden death after 2 years and a half of implantation. So because of those serious adverse events, we decided to stop our experience And now there is this new device that is softer, and it's covered by some ions, as you can see in the factoids. It's a kind of a ceramic coverage, which induces less fibrosis and probably less inflammatory process, which could be involved in the genesis of the AV block. So I think also another point on this device is a little bit longer. The waist is longer, is 3 millimeters. The old Platter device is only a 0.5 millimeter. And by elongating the waist, this was studied by the engineers in China. They think the device exerts less pressure on the crest of the VSD, and therefore minimizing the risk of AV block. So I think so far so good. I was one of the guys initially that had a let's wait and see kind of a position. So Raul and Cesar did a wonderful job with this study that just has been published. And let's see what happens. We have to follow up those patients. We have to do a continued access assessment, in these patients. And coming back to this case, I think we are ready to deploy the device. Cesar, don't you agree we are in the right spot? We should go ahead and release the device from the delivery cable.
Can I see the fluoroscopy?
Can you do a case like that without echo?
No, we are not. We are not doing any angio. Yeah, we are not doing any angio because this guy had a severe anaphylactic reaction here. It was tough to control. That's why we were sort of anxious to come on air. So this is the appearance of the device on 50 LAO 50 degrees, and cranial 19. And I like the separation of the device. Raul is telling me that he's really happy with that. So he's going to go ahead and release the device. Yeah, go ahead.
I think it's very, very important, these devices, before you release it, you perform an angio in aorta to see if you have any problem with the leaflets.
No, Cesar, I would disagree. You have beautiful pictures. Can we go back to echo pictures? Can you show me the aorta seat so there is no AI whatsoever?
Oh, yeah, sure.
Yeah.